Hi, this is Josh, dreambody.clinic, and today we're going to talk about the stem cell knee treatment. So the knees are the most common thing that we treat. It seems like everybody's knees tend to go out on them at some point. The most common thing is arthritis. Now, arthritis means the cartilage is breaking down. That's the cushioning right there at the joint, right? So with cartilage, if it's stage 1 or stage 2, meaning you catch it pretty early, usually it's a one and done type treatment. Now, if it's further and it's worse, stage 3 or stage 4, it could take multiple treatments. And we don't recommend coming back for, minimum 6 months, but most people at least a year. But the cool part is even 3rd or 4th degree arthritis, which are the bad stages, we can usually get at least 1 to 2 levels of improvement, meaning stage 3 to 2 or 1. I've had a few rare cases that were 100% with one at stage 3, but stage 4, best case, 3rd to 2nd degree. So in this video, you're gonna see my father-in-law, Nacho, doing his knees, and he was pretty much bone on bone. So we did his knees a couple years ago, and even with that, he's been great. He's still maybe like stage 3, stage 4. There was a little bit of improvement, but it did get rid of all the inflammation, and he's been pretty well pain-free ever since. So lately he's been walking his dogs, running on the beach and stuff, and they're kind of getting a little sore again. So we're gonna do him again, hoping we can improve him, maybe to stage 3, stage 2. And, he might need another treatment in another year. It's unfortunate. We wish it was like faster one and done, but look, he's in his early 70s and he's been hard on his knees. And this is just what happens with people. Now, they can also help with meniscus tears. That's the first thing I ever personally fixed. I even fixed some partially torn ACL, MCL, PCL, so ligaments, tendons, cartilage, meniscus. We can fix all these tissues, but it does depend on the degree of how bad they are. So the sooner you come to us after you have knee pain, the better results you're gonna have. It's a very simple treatment. So we usually fly in, rest the first day, day 2, we do blood work, do an MRI. Day 3, review it with the doctor so we know exactly what's going on. And we're straightforward with people. If we don't think we can help, we're gonna tell you. If there's a bunch of osteophytes, like your ACL is completely severed, well, they're not magic. They can't reattach that, we'll tell you. But for most people, it's just wear and tear, and we can do one simple quick injection. It takes a few seconds to do. You feel a little pressure, almost like a little balloon filling up in there. It really doesn't hurt. And then you're good to go. And most people leave the next day. In fact, Nacho, he lives here, so he's gone. But my my stepdad did it yesterday also. And my mom did it yesterday, because all they do is play tennis. And for them, yeah, they were a little sore last night. They took a Tylenol, pain went away, no big deal. It's a very easy, pain-free way to fix your knees. It's the most anticlimactic thing you'll ever do. It's almost frustrating. You're like, oh, why didn't I come sooner? It was just that easy. But unfortunately, because of the way the laws are in the US, they don't really allow this there. It's stupid, they should, but big pharma likes to just throw pills at you instead of actually fixing the problem. We don't agree with that. We want to fix the problem. We're really hoping you come. It's one time, never have to come back again. You'll probably come back for something else, but we're hoping you don't come back for your knees. So if you'd like to learn more, get a hold of us at www.dreambody.clinic. Call us toll free at 888-704-3977. I'm Josh, happy to help.